Welcome back to another episode of the Empowered Plates, Empowered Lives podcast. Y'all, it's your healthy habits and lifestyle coach, Giovanni, and I help those with endometriosis and polycystic ovary syndrome reduce chronic pain, eliminate distress, and minimize irregular or heavy periods through my M to the third degree healing empowerment formula. Y'all, today's episode, we got Dr. Joselyn Rodriguez in the building. But before we dive into this episode, y'all already know what time it is. And if it's your first time tuning in, thanks for coming through. But y'all, bye with me. Welcome to the Empowered Plates, Empowered Lives podcast. Y'all, welcome to the Empowered Plates, Empowered Lives podcast. Today, we're honored to have Dr. Joselyn Rodriguez with us, a highly skilled physical therapist and founder of Jae Physical Therapy, where she specializes in pelvic floor health. Y'all, that's absolutely very important for those of us with endometriosis, but it's good for all women to have a strong pelvic floor. But y'all, Dr. Joselyn's journey from athletic training to becoming a leading advocate for women's health has been shaped by her commitment to helping women feel good in their bodies, whether it's through sexual intimacy, everyday movement, or just preparing for childbirth. Y'all, so today she'll share her expertise on why pelvic floor health matters for everyone, how to address common issues, and why there's no such thing as too much information, also known as TMI, when it comes to talking to your provider. Y'all, today in the Good Vibe studio is Dr. Joselyn.
Ooh, thank you for that introduction. I am so excited to be here. You just got me hype. I'm excited. Let's do this.
We're excited to have you here. We're excited to have you here. The Empowered Plates, Empowered Lives podcast is really a safe space to be empowered for your own personal healing journey. And so I'm excited to have your expertise, your own experience with healing and health, but how you help others as well as yourself. But Dr. Joselyn, let's talk about that thing behind you, that image that you said was just delivered.
It was just delivered about 30 to 40 minutes ago. I'd been waiting on it for like maybe 3 weeks because it was, specially made for what I had requested. I had requested some sort of, image that would catch people's eyes, but still be able to provide some education. And so
don't tell them what it is yet.
Don't tell them what it is.
Yeah, don't tell them what it is. So y'all, in the comments right now, if you're watching on Spotify, you can comment. If you're watching on YouTube, the video version of the podcast, you can comment if you can see this. So, and if you're on 4 Vibrations YouTube channel, go ahead and subscribe and hit that notification bell so you don't miss anything. But y'all, I see a woman with the upside down heart as the head, which reminds me of like self-love, self-care. Okay. Like that's what I see. And then down below, I feel like I see like where the uterus would be a heart. That's what I'm thinking. So I feel like this is like women's love of their body, something that you want us to appreciate at all times. And then like a star in the middle. That's what I see. But tell me what it really is, Dr. Joselyn.
I love it. I think I love your version too. So this was actually made to depict a vulva. So a vulva is the area you can see outside of a woman's parts. So the vagina is the inside, the vulva is the outside. So here you can see the dark brown is the labia majora, the labia minora. This is the head of the clitoris. Then you have the urethral opening and the vaginal opening.
So the vaginal opening is what I thought was. That makes sense now.
Yeah, that's all right. But that's one of the reasons I kind of wanted it to be more abstract, where it wasn't like in your face, hey, this is a vulva. But after a while of looking at it, like, oh, that's a vulva.
And art speaks. Art clearly speaks because it spoke to me in a totally different way. And then what its intended purpose was and how you saw it was different too. But let's get into it because you already teaching us on this anatomy and the vibes and breaking things down and making it look so lovely. So Dr. Joselyn, you've had an incredible journey being an athletic trainer. And then you went to becoming a dedicated pelvic floor physical therapist. Can you share what led to you being able to specialize in pelvic floor therapy and how your experiences have shaped your unique approach, the Dr. Joselyn's unique approach to patient care?
So I started my career in medicine as an athletic trainer. It's just a very rigorous, program. And I got a lot of my knowledge and a lot of what I use today from my athletic training, education and experiences. As I got older, I said, you know what? I want to go back to school. I want to go get my physical therapy degree because I want to be able to treat not only athletes and not only people on the team, but I want to be able to treat anybody who needs some help. While I was in PT school, we had decided to get pregnant because at the time, I was an older student. I didn't want to wait any longer. I said, if I'm going to do this, we're going to do this now. And so we timed it perfectly because when I sat for boards, I was 37 weeks pregnant. So luckily my math was right. When I went to give birth at 40 weeks and 0 days, I thought I was this hot shot physical therapist who knew everything. And I quickly realized I don't know anything about delivery. Even, I guess because I was so busy with school and the baby shower and board, I didn't think about the actual labor part, the actual delivery part. And because I hadn't really prepared, I ended up having an injury. And so that has kind of shaped what I focus on. I focus on providing education specifically to women about their bodies and what to expect with labor and delivery and how to use their bodies to their advantages to help, maximize outcomes for us.
I love it. I love the journey. I love that you brought motherhood into it. And then I also enjoyed the part where you were empowered to know more because you didn't know anything about this real special act of motherhood. And you were like, wait, I don't know nothing about this. I want to learn more. Your curiosity allowed you to shift your career, but it was because you had a passion and a personal experience with it. And so I absolutely like and love that you shared that story to shift. But Dr. Joselyn, before we get too into this, let's kind of make sure we have a good understanding of pelvic floor. So can you explain what pelvic floor is and why is it so essential to overall health and well-being? And not just for people with endometriosis.
Very good question. Everyone has a pelvic floor. Women, men, children, everybody's pelvic floor. And so this is what the pelvic floor is, right? Pelvic floor is a group of muscles that sit at the base of your spine. So this is your spine, right? And then these are your hips, right? So it sits between your hip bones, okay? Now in a female, this is a female pelvis, right? So it's going to be a little bit wider than a male pelvis, but you can see that it's kind of like a bowl underneath your body. And so it helps support your organs. It helps support your trunk and allows for movement. It participates in sexual function. And it, contracts or relaxes depending on what you want to do in the bathroom, whether you want to let things out or keep things in. And so this is another picture of what the pelvic floor muscles look like on the inside. And it would be kind of like a bowl like this. Okay. And so because it's muscles, that's why a physical therapist or any other, occupational therapist can help with this.
I like it. Thank you for that breakdown. And y'all, if you're on your favorite audio podcast like Apple Podcasts and Spotify, make sure you come and check the visual version of this because she's really educating us and showing us with different props how to really see this pelvic floor and why it's so important. And honestly, Dr. Joselyn, for me, I didn't even realize that everybody had this pelvic floor and that it was important for everyone to, really find a way to approach it and incorporate it into their well-being, because I feel like there's so many different parts or aspects of health and wellness that people don't realize need some attention and some love. Like that's the whole part of overall well-being. And then you'd be like, oh, well, overall, I didn't even know I needed to include this and that. So yeah, this is definitely a safe space for learning. So then that way you can kind of make some adjustments. But Dr. Joselyn, can you tell us what are some common signs that someone might have pelvic floor issues now that we know what the pelvic floor is? And why is it important to kind of address these symptoms early?
For sure. So it's never too late to address something. So I've heard women say, 70s, in their 70s, oh, it's too late for me. No, it's not too late for you. Because we know that a third of our adults who go into, actually, I think it's two-thirds of our adults who go into nursing homes because their families can't, essentially deal with the issues they're having with their pelvic floors, urinary incontinence, fecal incontinence, things like that. And so it's important that we understand that it's never too late and it's never too early. Some people say, well, I haven't even been pregnant before. It doesn't matter. If you get things going now and improve the wellness of your pelvic floor, then that's going to set you up for less obstacles in the future. Some signs that you may be having some pelvic floor dysfunction, anything having to do with pee, poop, or sex. So if you're having trouble getting an orgasm, if you are having painful orgasms, if you're having pain with intercourse, if you're having painful bowel movements, if you're constipated, if you have hemorrhoids, if you are peeing your pants, if you're laughing and peeing your pants, if you're at the gym peeing your pants, if you feel like your core is very weak, if you have an abdominal hernia, if you have, or diastasis recti, where you have the separation of the muscles in the front of your abdomen. If you've had abdominal or pelvic surgery, how many of us are having hysterectomies or endometriosis excisions, right? Having, for men, prostatectomies, prostate removals because of cancer. People who've had tummy tucks, right? People who've had abdominal hernia repairs. These are all people who should then also either see a physical therapist or specifically a pelvic floor physical therapist, because the core and the pelvic floor are so closely related that it's important that if you have an abdominal hernia and you decide to have surgery, that's fine, but let's make sure that you're not doing the same behaviors that caused the hernia in the first place, right?
And I like the word behaviors. Like that's a good word, behaviors, because I think a lot of times people just get caught up in doing life that they don't realize the things that they're actually doing is a behavior, whether it be a good behavior, bad behavior, whatever you're doing is either going to help, hurt, hinder, or keep you the same. And so the whole purpose of being empowered is to get you to start being aware of some things, aware of some behaviors, to see, is this something I should shift, change, adopt, and do something different or new? But Dr. Joselyn, thank you for breaking down those signs that you might be having some pelvic floor issues. And so just to kind of run it back, when she talked about urinating, are you urinating when you're laughing? Is it happening uncontrollably and you don't even realize you're going because it's happening so fast? She talked about poop. Oh my goodness, she hit me on the poop, y'all. Painful bowel movements was a big thing for me before I even got the diagnosis of endometriosis. Painful bowel movements is a symptom of endometriosis. That was a big one for me, as well as like hemorrhoids. And before I was told like hemorrhoids, it runs in the family. And I could just only imagine now, Dr. Joselyn can just...
I've never heard that before. It runs in the family. That's a new one.
That's what it was told. That's what I was told to my family. Like, oh, hemorrhoids, oh, we get that in our family. And I'm like, what? Oh. And yeah, but again, that's just a sign of their
learned behaviors.
There we go, back to the behaviors. And then you hit us with the intimacy, the sex, the painful sex. Like in college, I was like, what is wrong with me? What's going on? I used to tell my college best friend, like, I think something is wrong with me. And it was like, well, you just got to relax. No, that's a different type of sign. And talking to other people with endometriosis and just other people, women in general, as you mature about sexual intimacy, pain, that's not normal. And so you really want to make sure you're identifying those things. And then painful orgasms, like, I don't know about you, but painful orgasms should not be painful. I think those are supposed to be some pleasurable moments. And so I want you, if you're experiencing those, to really consider seeking a physical therapist to help work with that pelvic floor and see what the issue is. And then I like that you talked about a weak core and how that relates to pelvic floor therapy. But then when you said people who are having tummy tucks, people who might have gotten like their prostate removed and having surgery, like laparoscopic surgery for those with endometriosis, all of these signs and situations might put you in a place where your pelvic floor could be an issue or an area that you need to address. And so I thank you, Dr. Joselyn, for breaking that down and breaking it down in a way that we can all get it and understand.
Thank you.
But the next question I have, Dr. Joselyn, is you just brought it up about the painful sex and the intimacy. What are some, what are some ways that people could potentially improve their sexual health with some like practical tips or positions that can help them if they're experiencing painful intimacy?
Right. That's a really good question. I love that you mentioned positions, because that's my first answer, is because everyone's endometriosis lesions can be in different spots. It's got to be particular to that person's needs. And so it's all about exploring what works and what doesn't work. And that may mean you have a partner who's open to that, or, you may have to have that discussion with them about the right, having the right state of mind, so that doesn't put too much pressure on you. I always talk to my patients about the importance of, when you have a history of painful intercourse, that you feel like you have the open dialogue with that person, but also that the expectation isn't always ending in penetration. Maybe we lower those expectations and it's just enjoying yourself. Not even, so that you don't have to think about, oh, eventually this is going to end in that, and that's going to be painful. That's going to change your experience. And which is eventually what your partner wants. Your partner wants for you to enjoy and be present in your body, not be present in your mind, because you're expecting pain in 5 minutes, 10 minutes. So it's always about find what works. That may mean you have to explore, different sorts of furniture to make it work for you. You may need to buy some knee pads. You may need to get, creative with what works for you.
I like that. I like it a lot, Dr. Joselyn. So what I love the most about what you just said about helping people that are experiencing painful intimacy was, first, you want to be present in the body and not your mind. And when you're ready to embrace pain because you know it's coming or it always is there, you're not able to truly enjoy it. No. And then here we go back again with the painful orgasms. Like, that is not something that you should want to be in pain with. But then when you talked about exploring different positions with an open mind, I think that was brilliant. And you want to make sure that everybody, or the people that are a part of this experience, are in that state of mind that says, you know what, I want this to be enjoyable for both of us. What are different things we can do so we're both having fun and this is pleasurable for both of us? But when you said we might need to explore some different types of furniture or furniture positions, and then those knee pads, man, you are making sure we're getting these things done safely and that we reach the goal. And that's the whole purpose. And I love that you also have that it's going to kind of go into that next question. I love that you have these conversations with your patients, Dr. Joselyn, because I remember talking to you and you were like, many providers, they just don't have the time or the comfort level to discuss intimate details like painful sex or pelvic floor issues and all the different things that can do that. Why do you believe it's like it's crucial for patients to like openly talk to their providers or find a provider that openly talk to, and how can they advocate for themselves when they feel these concerns aren't being fully addressed?
Yeah, unfortunately, with the way our medical system is structured currently, a lot of providers don't have the time. And the beauty about being with physical therapists is that our visits are usually scheduled for at least 45 minutes to an hour. And I mean, when was the last time where you had one provider sit in with you in one room with you for that long? It doesn't happen very often. It definitely doesn't happen with the MDs, not unless there's a significant like crisis happening in that moment. And I think it's really important that, people understand that when you come to see a pelvic floor physical therapist, it's a complete open conversation. It doesn't have to be just you. You can bring a partner with you. so that you feel more supported. You completely dictate how the session goes. When it comes to my patients, like I just saw someone earlier this morning who was, texting me like, I don't know, every chance she could, she was giving me like a reason why she shouldn't come. And I said, don't worry about it. Just come, we'll see what happens. We didn't even do an internal assessment. We didn't do a pelvic floor assessment. She was complaining about some neck pain, some tightness. I said, let's just address that. We'll work on maybe some hip opening where it's you doing the hip opening on your own. And I did some dry needling to her upper traps and to her TMJ region, her masseters, because of her pelvic floor tension, she's tensioning everywhere. She does have a history of, traumas and things like that. So, I said, we don't have to do, when you see a pelvic floor physical therapist, the ball is in your court. You dictate what you do and do not want to do, because we always give you options. And we understand, because this is such a delicate and intimate topic, region of your body. And so with a pelvic floor physical therapist, you can then also have the time to discuss these more intimate questions. Because if we're not getting into the details, then we're missing things, especially when it comes to processes like intercourse, trouble with intercourse. The example that I had given you when we spoke was that I had a post-cancer treatment patient with some vaginal dryness and having significant difficulties with intercourse with her partner. And she's like, yeah, and I use a lot of lube. It's like, okay. And she had said that before. And then this time I was finally like, where are you putting the lube? She goes, oh, we just put it on him. I'm like, have you tried putting inside yourself? She's like, I never thought about that. She came back. She was like, that helped a lot. Okay. So there's one. She came back again and she was like, I'm having trouble with a dilator. A dilator, it's kind of like a phallic medical device that you use to help stretch the tissues vaginally. I'm having trouble with the dilator. Like I'm having to go lower in size. I'm like, okay, where are you putting the lube? On the dilator, I was like, did you try putting some inside the vaginal canal too? She's like, I should have tried that. You're right. Okay. So it's just those small, like little details that can make a huge, because a lot of this is trial and error. Not everybody's the same, So you just have to figure out what works best for each person and go with it.
I like it. And I thank you for taking us through like patient experiences. But the biggest thing I love is that when you're missing the details, you're unable to really get to the root causes and being able to benefit it. I love that. The second thing I loved is that you said with a pelvic floor physical therapist, you get to dictate the journey. You get to say what it is that you want and you don't want. So if you're not open and vulnerable enough, you're not going to get the care that you ultimately deserve because you're not leading it. And it's about you being the leader in your treatment care when you're working with a pelvic floor physical therapist. Love that too. And then I like that you talked about the trauma and you talked about people with a history of trauma. They're going to have some of that stored into their hips. And so I saw this video the other day and it was like a few like hip opening exercises, movements to kind of release that energy. And I was like, ooh, I think I want to try that the month of September and see how my body feels, see how things fit for me. And I know we're about to get into movement, but let's just hit on one thing that you talked about that people may not know enough about, and that was dry needling. Can you talk a little bit about what dry needling is in regards to that method and how that was beneficial?
Sure, definitely. So dry needling is using essentially acupuncture needles, but for a different purpose. Okay. So physical therapists, depending on the state that you're in, can provide dry needling treatment. And what research has showed is that when you put the needle into a tensioned or bound muscle, it provides the physiological effects that will allow the tension to be released. So if someone has tension in their TMJ muscles, the muscles around the TMJ, so the masseter, the pterygoid, the temporalis muscle, you can decrease that tension and it just feels like, literally, it feels like it's melting away. I've been treating myself because I know that I have some TMJ issues, and it's been amazing. I've treated a number of people and they say it feels great. Dry needling can be done pretty much anywhere in the body, to the muscles just underneath the back of your head, in the neck, low back, hips. I've been dry needling someone's hip muscle, but through like their perineal region. So I'm trying to get to this muscle here. I have them laying on their side, and I'm needling through the perineal area. So if I'll show you here. So I'm dry needling like through this area in the hip, towards the hip this way. And that person was having years of discomfort, seeing a number of different pelvic floor physical therapists, trying a bunch of different things, even had like an e-stim unit like placed into her body to try to help with this pain. And, I've been seeing her. I took her on as a patient, and I was like, let me try some dry needling on you. And we did it. And within the first dry needle session, she came back and said, I almost feel like myself again. She said, I almost thought about having intercourse with my husband after 7 years.
Whoa.
It's been something like that.
That is beautiful. Now you held up that body part, yes.
The vulva?
Yes, the vulva. You held up the vulva, and you talked about needling. Somebody that might be apprehensive about you putting a small needle near the vulva, even though we just heard how powerful the transformation.
Well, it wouldn't.
No, I'm just saying, because even some people just are scared of needles too, Dr. Joselyn. How has your training been in order, like people train with dry needling? How intense or intimate or important is it? Like, what do you kind of go through to know exactly how to, navigate the treatment? Because I love it, because it's still a holistic approach to getting that the benefits of what you're saying is not a medicated thing. And some people are for acupuncture, some people aren't with like the needle thing. So can you talk about like your journey on how you were able to learn the skill of dry needling so you can be able to provide this type of relief? Because clearly we see the benefit of your skill set.
So the needle, and I can grab one real quick. The needle is very thin. Most people just feel the initial prick when it goes into their bodies. Okay. Most people. But if someone has a lot of tension, they might feel more. So because of the extensive knowledge physical therapists already have in anatomy, that essentially just gets transferred to appropriate locations for the dry needle to be placed. So in the state of Florida, every state is different. And there's even some states where you can't do it at all. Like the state of New York, dry needling is not okay for physical therapists to do. So physical therapists have to look at their state practice acts. But in the state of Florida, I had to do, it was 50 hours of courses. And then I have to do 25 treatment sessions under supervised care, like with supervision of someone else who's already been doing it for at least a year. I specifically chose to make my first class a prenatal and postpartum course for dry needling, so I could learn the perineal, the pelvic floor needling specifically, because there's not that many people doing that, right?
So clearly there was a demand for this.
Right. Yeah. I had to travel to DC. So I had to absorb the cost for the course, travel to DC to take the course. This is not easy to do, but I learned so much, and it really makes, I may be, maybe, I don't know, but I may be the only person, at least in South Florida, who can dry needle the pelvic floor.
And that's definitely very valuable, because you just heard you just heard Dr. Joselyn say she did it for one client one time, and after that one time they felt so good that they almost wanted to actually embrace intercourse with their husband after 7 years. Not 1 year, not 1 month, not 1 week. She said 7 years. And I thank you for walking us down that path, because you know what, Dr. Joselyn, I don't believe, sometimes people say, okay, this is my specialty, but they don't realize how there's specialties within specialties and skill sets that people pursue just so they can be able to provide a different approach to healing, and healing in a holistic manner. You know what I mean? And that's brilliant, because so many people can get kind of on that level of medication and pharmaceuticals and expecting a drug to do something for you. But I'm loving that here on the Empowered Plates and Empowered Lives podcast, we're exploring holistic ways, alternative ways like functional nutrition, dry needling for relief for those with endometriosis, polycystic ovary syndrome, because it's possible. But it's actually doing your research and finding the providers that actually have skill sets that you need, that want to see you be in a better state of health. And so I thank you for breaking that down for us even more and telling us what you had to do just to invest in that skill set. So let's talk about movement, because I know you were an athletic trainer before you were a physical therapist. Pelvic floor therapy is a big thing for you. So movement is key in your work. How do activities like squats, yoga poses, I think you mentioned like the puppy pose, the pigeon pose,
Yeah,
exercises kind of contribute to pelvic floor, and what routines do you recommend for someone?
Yeah. So I'll give you like the basic outline of my first couple of visits with my patients. Everybody gets education on what I just told you, the pelvic floor, what it does, and the movements that are necessary to pee and poop correctly, right? Everybody gets that education. If I see that someone is unaware of how to do those movements, then I focus on that first, because the most important thing is awareness. If you are not aware that you're tensioning your body 24 hours a day, 7 days a week, then no matter what I do with you in this room for an hour or 2 hours a week, none of that's going to work. None of that's going to carry over. So the awareness key is a major component of what is going to help someone be able to progress, make progress, maybe slow, but still make progress, as opposed to have too many regressions. So they're going to get the education, they're going to know what their body does, and then I'm going to show them some exercises that they could do anywhere, so people aren't like, oh, he's doing a pelvic floor exercise, oh my God. No, these are things you could do anywhere. For example, like a deep squat at the wall, supported by the wall, where you can completely let go of the muscles there. That's one. You mentioned pigeon pose. That's great, because the pelvic floor, the hip and the back are so closely related and intertwined that if you have, too much glute engagement, too much glute tension, or glute muscle shortened glute muscles, then that could be contributing to your pelvic floor dysfunction. For example, I have a mom who's she has 2 kids. Her last child was born maybe 9-10 months ago. And she's a physician. And every time she goes to stand up, she leaks a little bit. She says she leaks all day. Every time she goes to stand up, every time she goes to move. In the last session, I realized that she's a glute over gripper. Every time she over activates the glutes, that's when she leaks. So now we have to switch gears and improve her awareness as to when she's doing that. Because as mom or anyone who gains weight, their posture changes, because the weight offsets their center of gravity. And with that forward progression of their weight, then you have the glutes being overactive and shortened. So now we have to switch gears with her and focus elsewhere and have her improve her awareness to not overgrip the glutes. And so that's why the glutes, stretching the glutes, the piriformis, making sure all those things aren't overgripping or too tight, are super important with pelvic floor health.
I like it. I like it a lot. The first thing that came to mind, Dr. Joselyn, was I thought about Dr. Dion, and she was the first physical therapist, pelvic floor person I had on the podcast.
Love her.
And I love her too. And what I loved about it was we were talking about tension and how tense people typically are all day, all the time. And so after that conversation, I started using the body scan reminders, posting that and be like, let the belly hang, because a lot of times there's tension in our stomach, also in our shoulders. Yeah. And even as you're talking to me and I'm listening to you, I'm still learning. And when you're talking about tension, I relax, because I'm holding my stomach like this at certain times, just listening. I'm like, okay, relax. And it's such a good thing to do, body scans, because you never really know when you're holding that tension. But you took it a step further just now. You said not just to be mindful of where the tension is, learn that awareness, and then figure out how to approach that awareness. So then that way you can start seeing a change in your, what did we say earlier? Your behavior.
Awareness and behaviors. Yeah.
Yeah. And I like that you do that for your parents, because your patients, because now you're saying, you know, it was this whole thing. Every time she stood up, she'd have a little slight, you know, pee interaction. And it was like, oh, you're overworking your glutes. And then you brought in posture, you brought in weight changes. And I don't think people really realize how some of these things, again, come right back to pelvic floor health. And then you already told us at the top of this podcast episode that that's everybody included, not just women experiencing endometriosis and different conditions. I like that you start your patients off with awareness, education, how the body works, how you should appropriately pee and poop, because I don't think we learn those things at all. Even like I heard people say, oh, you're not supposed to strain when you poop. But I just have this feeling, Dr. Joselyn, that you don't have just a 5-minute conversation on the proper ways of how to urinate and how to poop.
Conversations are not all I do. We are actually doing it. We are simulating being on the toilet. We are simulating what exactly they do. Do they hold their breath? Do they clench their butt? Like, no, those are all bad things. You should not be holding your breath. You should not be clenching your butt. You've got to create a tunnel, not a wall. Tunnel. You want to let things through. Okay.
And tunnel and not the wall.
Tunnel, not a wall. And another thing I see with a lot of my male patients is this tendency to hold their breath when they're doing heavy things. And I think that's what leads often to abdominal hernias, is these people's tendencies to hold their breath when they're lifting something heavy. Okay, I get it. But then you're also then holding your breath when you get out of bed every day. Okay, is that really necessary? And then you're holding your breath when you're, grabbing, your purse. Like, why are we doing this? You don't need to do that. The breathing and oxygen is a source of life and energy. Don't cut yourself off.
Say it one more time, Dr. Joselyn.
Breathing and oxygen are the source of life and energy. Don't cut yourself off.
Had to write that one down too. Breathing and oxygen are the source of life's energy. I love it. And you know what came to mind when you talked about the holding of the breath when you lift heavy things? I know that sometimes, like before you get into a surgery for endometriosis, they also ask about hernias. And now it makes more sense, because you just talked about the typical activities that we do, and we're holding our breath, and how that can cause distress to those muscles in the abdominal area over time, because you're constantly in that state of stress with it. And so I thank you for breaking down that whole tension aspect in the abdominal part. But I love the education that you give your patients as the first approach with the stimulations of peeing and pooping. And then you talk about how the body is supposed to function, how it actually works. That's also empowering with your patients. And then you say you go into the actual examples and movements for their routines, like the wall squats, based on what's happening in their body. Not just everybody do wall squats, not everybody go do this. Like, it's definitely a personalized approach with knowing what's actually happening and going on with your body. And I think that you can only get to the root cause when you have specialists that know exactly what's happening and can dialogue with you in that discussion to best identify what's happening in your body, because the body is so complex. So thank you, Dr. Joselyn, for kind of giving us a sneak peek of how we get educated and empowered as one of your pelvic floor therapy patients. So let's talk about the cancer patient you talked to me about earlier, and you mentioned earlier on the podcast about the painful intercourse. How do you think pelvic floor therapy helped these patients, and what strategies or products like lubricants and do you actually recommend? So you asked her, did you put lube? Did you do, what are some of those lubricant products and activities that you can suggest to other people?
Yeah, so I mentioned dilators earlier. So dilators are an over-the-counter device that you can use. They're different sizes that help someone who's having trouble with vaginal intercourse, or there's even rectal dilators if someone's having trouble rectally, whether it's to defecate or pain, or for rectal intercourse, if that's when they participate in anal intercourse. There's different lubricants depending on the orifice that you're using, right? And so you want to make sure that you're using the right type of lubrication. And for vaginal dilation or intercourse, recommend water-based lubes. Some good ones are Slippery Stuff, Uber Lube, and Good Clean Love. Good Clean Love is organic. All of them are like BPA free, sulfate free, all that stuff. Any other products? So if someone, let's say, has a history of breast cancer or any kind of cancer, estrogen-based cancer, and they can't have estrogen in their bodies, those people often then have lots of vaginal dryness, not just for intercourse, but just in general. They'll be walking around and they just feel uncomfortable. Maybe the dryness may even cause itch too. If you think about like itchy skin, dry skin, it can become itchy. And so it's not just about intercourse, it's about just being comfortable in your body. And so there are non-estrogen creams that you can use, like the Magic Balm. And there's one by Mama Apothecary too. And then of course there's like other vaginal moisturizers that can be used, like Refresh with a PH for the F, Refresh, that's an over-the-counter. All of those are over-the-counter. But yeah, that for cancer patients, no matter what cancer they have, if they are for whatever reason taking estrogen, I forgot what the term is, estrogen, not receptors, things that limit their estrogen, they will most likely have vaginal dryness at some point in their life. And it's unfortunate that, I recently saw a woman, 34 years old, had breast cancer in one breast, luckily had a mastectomy and everything was clear. She decided to have prophylactic. So that means she didn't have cancer on the other side, but she wanted to have the other breast removed. She decided to do that. And I was seeing her for shoulder pain. But no one had spoken to her about the fact that she was taking these medications that limit her estrogen, and that given her age, she's likely at some point going to have some vaginal dryness. And so I gave her some tips. I'm like, hey, when this happens, here are your options. All right, now let me go see your shoulder.
Yeah, I like that. And I'm so grateful that she was under your care to where you were able to understand what all was going on with her. So it wasn't just the shoulder. You were able to also educate her in regards to her breast cancer and then life after breast cancer, to still keep her on this holistic journey to healing and not hurting, and keeping her aware. So go ahead, Dr. Joselyn, living in your purpose, shining light and being bright. I love it. I absolutely love it.
Thank you.
And I thank you for kind of walking us through some of those products that you would recommend. And special shout out to Good Clean Love being organic as well, and BPA friendly. So I like that. I love it. I appreciate that. I hope y'all are getting a whole bunch of value. And if you are, please don't forget to make sure you're following Empire Plates, Empire Lives podcast on your favorite podcast distribution platform like Apple Podcasts and Spotify. You're getting value. Make sure you rate it. And if you're watching on YouTube, drop a comment on some takeaways, because Dr. Joselyn is not holding back and she is educating. Like, this is a truly amazing experience to just get empowered, but most importantly, get educated on all things pelvic floor therapy and your overall well-being for all people, not just people with endometriosis and polycystic ovarian syndrome. So thank you for that. So Dr. Joselyn, how can we break down this stigma around pelvic floor health, and what advice do you have for starting conversations with healthcare providers, friends, or family about the whole too much information? And let's start making time for the details, because that's where real healing can truly happen.
Yeah, it's important to remember that it comes down to your health, right? If you aren't prioritizing yourself, then nobody else will. And so if you get the response of that's TMI, especially from a provider, that's not the person for you. Go look for someone else.
Come on, go look for
And,
something.
a lot more people are talking about pelvic floor dysfunction. You go on Instagram, you go on TikTok, and everywhere, people are talking about it, which is amazing. But the thing is that providers, physicians, are either sometimes not aware of when an appropriate referral can be made, and or they think negatively about this specialty, or they feel like pelvic floor physical therapy won't help in this case, whatever that special case is, right? And it's possible that it won't help, but it's not going to hurt for someone to go have an assessment. In my eyes, a pelvic floor, physical therapy assessment should be like going to the dentist. It should be one, maybe even twice a year. Just check in. How are things going? Are you developing something that we should have, pay more attention to, or that needs to have some treatment? And hopefully, and in most states, you don't need a physical therapy prescription to start your care. There is open access in the majority of states, where you can walk into a clinic and say, I want to be seen for physical therapy. You'll have to find a clinic with a pelvic floor physical therapist, but you should be able to do that. Then the question comes with, insurance coverage and all that, which you should talk to the clinic about. But unfortunately, the truth of the matter is that there aren't enough pelvic floor therapists in the US, and there are even less number of pelvic floor physical therapists in hospitals, and in hospitals is usually where insurance is taken.
I like it. I had no idea you had open access to see a physical therapist with pelvic floor therapy.
Yes. Anything.
I was 8 years old to find this part out.
The issue is that some facilities require a prescription from a provider because it's required by the insurance. So we're tiptoeing and doing what insurance carriers want.
Gotcha. Understood. 10-4. I thank you for that. I love the check-in. I love the open access. So thank you for putting that insight out. So kind of want to take this moment to just really empower patients to take control. I want you to empower some patients about taking control. What are some top tips for anyone looking to improve their pelvic floor health and overall well-being that you can give someone today?
Very good. I think I mentioned earlier, stop holding your breath when you poop. I want you to not hold your core and your abdominals all day, every day. Stop doing that. And 3, drink more water.
Do you have a preference on the water?
No.
Do you think
just
that
drink
one water
more of it?
Or do you just
you mean like alkaline
hydrated?
versus...
I mean, some people say alkaline, some people say spring water, some people say coconut water, some people say get your water from vegetables and fruits like watermelon, cucumbers. Like, are you just wanting us to stay hydrated or particularly get water?
I would say we're not drinking enough fluids in general. So if you could add more soups to your diet, more, fruits with lots of water, great. But make sure that you're getting enough, because so many of us are constipated and don't even know it. And that
You're right.
is the worst for our pelvic floors, constipation. That's how we get the hemorrhoids. That's how we develop pelvic organ prolapse, usually. It's just so much unnecessary tension on our pelvic floors and pressure on pelvic floors that we don't need.
I like it. I appreciate
because a lot of people don't even know that some people just sit on the toilet and breathe and it just comes out. Did you know that?
I did not know that.
Because some people their whole lives have always had to work so hard for it.
I didn't. And you already said before, it's the tunnel, right? Not a wall. And you already told us about that earlier. And I like that you even put that on there because you called me out again. I definitely used to have to focus on breathing because the bowel movements were so painful for me. Like I would have to hold on to the side of the walls
Oh
and do kind of
man.
like Lamaze breathing. Never had kids, but it was like that deep breathing to try to relax my muscles because it was so painful just to pass the bowels. And
Yeah.
so, which you also said earlier that I learned, I was today years old, about different spots that the lesions are with the endometriosis that could cause the pain when you're doing
Yeah.
different activities, like the painful urination, the painful bowel, the lower back pain. Like it's just an array of
Yeah.
different things, but it's all based on the location of the
Yeah.
lesions, the scar tissues, the cyst,
Yeah.
everything. So
There's
I'm in
even there's even been women who have had it. Endometriosis can be anywhere in the body. Some people have had it on their diaphragm, which explains why they can't take deep breaths. Some people have it's caused like a pneumothorax, is where the lung collapses because of where it is. I think one paper said it was found in someone's eye. Like it could be anywhere. It could
It
literally
can
be anywhere.
definitely be anywhere, and it's such a like a complex condition, and I know more people are talking about it, but I like that you said it could be anywhere. I've had guests that had several lung collapses. I've met women with lung collapses from it, some that's even been found in their brain. It's just all over the body. And so I'm glad that you brought that back up into the conversation as well, because you just never know. But let's go into what you just said. One, stop holding your breath all day, but most importantly, when you poop. So number one, stop holding your breath when you're pooping. Be mindful of tension in your body. Let that belly hang. Reduce the tension. Drop the shoulders. Loosen up the glute cheeks, because
Right.
that's very beneficial for you.
And the
right?
jaw.
As well as the jaw. Yes, ma'am. As the jaw. Two, don't hold your core. Goes back to let your belly hang, especially when you're picking up things and strong things. Like she said, heavy lifting causes hernias, and you're not breathing, holding your breath in when you're doing that as well.
Yeah.
And then three, drink more water. And she gave you tips. If you don't like water, that's somebody like me, don't like typically just drinking regular water, then you can make sure you're getting more soups in. You're getting in your high water fruits and vegetables, cucumbers, watermelon, like consume more of those things, so that way you're staying hydrated, so your constipation issues, your bowel movement issues, the poop can pass through, the pee can pass through, because it's a tunnel and not a wall. It's a tunnel, not a wall. So thank you, Dr. Joselyn, for those
Awesome.
tips. And just kind of, I guess the last thing I would just say is like leave some listeners with the importance of understanding and caring for their pelvic floor and how it can positively impact their relationships, their self-confidence, and their quality of life. We talked about that standing up and peeing. That cannot make you feel confident. You talked about having painful sex and not wanting to have sex with your husband after 7 years. That has a strain on relationships. Kind of talk a little bit about that, empower them in that aspect, and then we'll get into our last two questions.
Yeah. I think a lot of people don't understand the role that certain parts of our bodies have, not only in our relationships with others, but in our relationships with ourselves. And if you believe in energies and things like that, you have the sacral chakra, right? That is found in the pelvis, and so much energy and trauma can be stored there, and that can be cutting off your potential to be the person you're supposed to be. That is essentially self-limiting if you're not willing to take the time to address the pelvic floor issue or the trauma that you have in the region or the energy that you have stuck there. You're limiting the potential of your life's work.
And that goes right back into pelvic floor, right back into how you really value, but most importantly, the behaviors you structure around your pelvic floor health and overall well-being. And it'll get right into that energy. I like it, Dr. Joselyn. All right, last two questions. Give some tips, some strategies, some support for girl dads, male role models, father figures, for young women who might be experiencing pelvic pain, irregular periods, some of those issues, as well as for spouses, partners, people who also
Mhm.
experience those as they get older? Can you give some
Yeah.
tips, strategies for them?
Something for the dads and the partners, sure.
Mhm.
So for the dads, even in a very young age, it's very important that you have you develop your child having confidence in their body, and especially little girls, they need to know the true name of their body parts. Unfortunately, we know that there are people out there who target little girls, and if a little girl, and I believe that there's actual research about this, is that when a little girl knows the actual name of her body parts, she is much less likely to be assaulted and taken advantage as a small child. So my 5-year-old knows the difference between her vagina and her vulva. And she says it all the time. She says she uses the terms all the time, right? Because I want to minimize her risk of being assaulted as a child, being taken advantage of. So make sure our little girls know their anatomy, and you don't shame them for their anatomy, right? As a support partner, ask them how they need you to show up and support them, because everyone's different. Maybe when they're going through their flare, they want a heat pad, and you make sure that that heat pad is ready. Maybe they want to snuggle. Maybe they don't want to snuggle. Maybe they need a night by themselves. And so everyone's going to respond differently. And just remember to encourage them to speak up, and try not to. I know it can be exhausting. As exhausting it is for you as a supporter, it's even more exhausting for them as the person dealing with it, knowing that it takes years for someone to get a diagnosis, and even more so to get the right treatment. They're exhausted. And so just, be as supportive as they need you to be.
That was beautiful, Dr. Jocelyn. I appreciate that. And one, I love the dads having them instill confidence in their young human beings, their young ladies, girls, however they identify, but knowing if they're having that pelvic pain, those period issues that are not normal, for them to really build that confidence in their body. I absolutely love that. Then you broke down the fact that knowing body parts, them knowing body parts as young girls, women, children, they're less likely to be assaulted as a child. That I never heard that before, but like if you heard it today, you know it. You can't step away from that. So do your part in really helping educate on body parts to these young women, these girls, those who have the vulva, the vagina, all of those things. So that way we're helping go against something that is slightly common, and that's these young girls being amongst predators and things of assault, even when it comes to people they may or may not know. And so that was just a powerful statistic, and I'm just so grateful that you shared it. And then two, for some of those older, mature people, is ask how you can show up. Ask how you can show up. And that was brilliant, because you talked about, okay, do you need a heating pad? Do you just need to cuddle? That's brilliant, because those things are relaxing to the mind as well as to the body. And so if you're looking for a hot water bottle, you can get that from 4vibrations.com to help you with that heat therapy, as well as a weighted blanket. If you don't have anyone to cuddle with you, weighted blankets have a way of really truly helping you relax and feel that level of comfort within yourself when you don't feel as good in your body. So go to 4vibrations.com and check out some of these products that could be beneficial for you as you heal. But third, you said speak up, because it took them so long to get a diagnosis. One, and then it's going to take them even longer to find the appropriate treatment that works for them. And that is truly a journey. And that's why I call it my healing, my journey, in regards to how I support and empower you on adopting those healthy habits and lifestyle changes, rethinking your behaviors, becoming aware of them, and then starting to shift them based on what it is that you want to explore in regards to your healing. That information is in the description of this video as well, if you want to learn more about it. Last question, Dr. Joselyn. If you could have a meal with any historical figure, who would it be and what would you all eat?
Oh my gosh, who would it be and what would I eat? Whew. Who would it be? I would say Harriet Tubman. And what would we eat? I recently I took a trip to New Orleans, and I recently started, for my first time, I had shrimp and grits, and it was delicious. So I'd want to have some shrimp and grits with Harriet Tubman, so I could hear about all the amazing journeys she took and all the people she helped.
I love it. You're not my first Harriet Tubman, but you are my first shrimp and grits. And I love that you went to New Orleans and got your cherry popped on the shrimp and grits, because it's definitely a total different vibe. Like shrimp and grits are absolutely
really
amazing.
Good.
I love shrimp and grits too when I had them. Now you're making me feel like on this high raw journey I'm on, how can I get a spin on some shrimp and grits in some way, shape, form, or fashion? I'm not quite sure. I might need to tap into some of my local raw plant-based chefs and see if they can get me a spin on.
Figure it out.
Yeah. Now you got my cheeks watering. Like now I'm extra hungry. But let everybody know where they can find you, Dr. Joselyn, and where they can follow you as well and tap into all your good vibes.
Sure. My website is jaept.com. And my Instagram is The Pelvic Trainer. I do lots of, free content on there for anyone who just wants to get more education. I do have a Spanish language page that isn't as active, but I'm going to be hoping to put some more stuff on there. And that's La Pelvic Trainer. Just feel free to reach out to me. And if you have any questions, I used to teach health and PE, so I love just teaching people about their bodies, and so that's clearly continued throughout all of my careers.
I love that you used to be a health and PE teacher. I was definitely, that's what started me in education, was being a health teacher, and over time they've shifted my like my class, my curriculum, my subject area, and so like I'm thinking like, next time I go abroad, will I go abroad and go back into health? Because I just love like health promotion and promoting healthy habits and lifestyle changes and different things and making people aware of it. But Dr. Joselyn, thank you for being an amazing guest on the Empowered Place, Empowered Lives podcast. Thank you for sharing your wisdom. Also, thank you for being someone who's also helping with our Spanish speakers and making sure representation is there as well. It's your healthy habits and lifestyle coach, Giovanni. I am excited about empowering you on your healing journey. So make sure you tap in and utilize all of the valuable links in the website, including in the description of this video podcast episode, including where you can contact Dr. Joselyn as well. And if you're looking to embark on an 8-week journey, I have an 8-week wellness journal for you to go ahead and start becoming aware of those behaviors we talked about today in the description. So go ahead and download that for free and start getting empowered about you and what you want to change on your own personal healing journey. Yeah, I love you. I thank you. But most importantly, thanks for vibing with me, y'all.
Bye-bye.